You didn't come for the strong, you're here for the broken. This is my song, I'm in the session, God. Only you know. Only you know how it feels inside. This pain when you try to hide it. Afraid to cry for help, you smile and drown it out. Only you know how it feels inside. To try and try and try and try and try and fail. Only you know why it's 8 o'clock and he's not home. Out with his boys drinking, cause he knows when he goes home and opens that door, it's another night of fighting or silence. Oh, she's cutting up deep, and they just think that she's crazy, but you know better, doctor. You know she's being touched in the wrong way. Oh, doctor, can you heal him? I pray, cause if you don't, he will not make it. Doctor, can you heal her? I pray, cause if you don't, she won't make it till the morning. Doctor, can you heal them? I pray, cause if you don't, they will not make it. Doctor, can you heal them? I pray, cause if you don't, they won't see the morning. Oh, 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 oh. Only you know how she feels inside. These feelings she's trying to hide, that's for another girl. It's not supposed to be. Only you know she prayed and prayed. How much she is afraid to get the help she needs, that your blood can set her free. Oh, only you know he's going to church but losing hope, cause he's tired of repenting for the same things over and over. It's almost over for him. Only you know I'm surrounded by broken people, and they need a hero cause they can't fix what's wrong on the inside. Your boy's here to see them. Doctor, can you heal her? I pray, cause if you don't, she's not gonna make it. Doctor, can you heal her? I pray, yeah, cause if you don't, come, no, doctor, can you heal them?
Everyone, welcome back to another episode of Heavenly Medicine, and I'm your host, Dr. Zayniah Louison. It's such a pleasure to be back with you guys. I actually felt like I missed you for last week, but as you know, the life of a doctor is not easy, and we're always called to do many different things. So I'm so sorry. My apologies for our for last Tuesday not being able to share an episode with you guys, but it's a blessing again and a pleasure to be here once again with you. So today we have a special guest with us, and I'm just gonna introduce him a little bit. So first of all, he is a son of the soil. Okay, that's very important to us here on Heavenly Medicine. We're appreciative to have our own. So it's a pleasure to have him with us today. So we have with us Dr. Azel Baptiste. Okay, so I'm just going to share a little bit about Dr. Baptiste. So very humble young man. So he grew up in a family of 5.
Yeah, a family of 5.
All right. So he has 5 other siblings. He also went to the St. David's RSC primary school. Later on, he went to the Grenada Boys Secondary School. So he completed his tertiary education at the TA Marischal Community College, and he also taught at the Wester Hall Secondary School. So I myself, that's me and Dr. Baptiste were actually good friends from since Wester Hall, right?
Definitely.
Because we also would have taught at Wester Hall Secondary School. So we're really proud about our iguanas.
Exactly.
Iggy, Iggy.
Go, Iggy.
All right.
Oi, oi, oi.
I know. Okay, so that's an inside thing. So only Wester Hall
Definitely.
people might
Would
know about
would
that.
definitely.
Okay, so I hope you guys are locked on. I hope you guys are listening because you have your very special, not just Mr. Baptiste, but your very special Dr. Baptiste with us this afternoon. So just to add, he also studied at the Latin American School of Medicine. Dr. El Salvador Allende. I hope I pronounced that correctly.
Allende.
Ay. Okay, so correction. Where he obtained his medical degree. So in general, Dr. Baptiste would say, when you ask about him, he would say, you know what, Zayniah, I'm a lover of people, medicine, and sports. So, tying out all these three, that's it. That's what we have, right? Dr. Baptiste, right? He loves his patients, and today he's with us to share on the topic, the prostate. So I'm just welcoming everybody, whether you are listening via YouTube, whether it's Facebook.
Share the link, especially all the men. Share the link. If you have a male friend outside there, your dad, your uncle, your cousin that's a male, you want you to invite them and share the link, because this is a very, very important topic that we are about to discuss.
Okay.
Especially in our culture, in the Grenadian culture, where men are so timid, men are so macho, in the sense that they don't want to touch that topic. All right. So please share. Sorry to cut you, but please share. Please invite your buddies, your friends, your co-workers, whoever it may be that is a man. Please invite them.
Okay, so you see, guys, he's very passionate of this topic. And again, we just want to welcome all our viewers, all our listeners, whether you're listening to us on 103.1 FM. We welcome you this evening. I hope you just sit, relax, and really enjoy the show. So as Dr. Baptiste is going to educate us on the prostate. So first of all, we just want to discuss a little bit more, Dr. Baptiste, about why I know you have a passion for this, and tell us why. Why you think it's is it something you think that the public needs to know about?
Definitely. To begin with, I would just want to share some statistics, and these statistics are based on the General Hospital where I presently work. All right. The statistics those statistics are dated from 2015.
Okay.
All right, and we'll touch a bit further about what is benign prostatic hypertrophy or hyperplasia, and what is prostate cancer.
Okay.
And we are as a nation, and in men in general, men don't, on a whole, we're not like ladies. We are a bit more timid. We think we're more macho, in the sense that we don't go to the doctor and so on. And sometimes when we get to the doctor, it's water more than flour. So it's a topic where men should be sensitized.
Yes.
Where men awareness should be we should promote awareness, especially when it comes to the elderly men and so on that suffer a bit more from those diseases. So I'll share a bit of the statistics with you. In 2015, 83 males were diagnosed with benign hyperplasia, prostatic hyperplasia. We had 9 deaths. All right. In 2016, 99 men were diagnosed with benign prostatic hyperplasia, and we had 7 deaths. 2017, we had 125 males being diagnosed with benign prostatic hyperplasia, and we had 12 deaths. And if we look at the trend, we can see that there's an increment. There's an increase in the number of persons that are being diagnosed on a yearly basis, what we call the incidence, and also the prevalence of prostatic diseases and so on, prostate cancer and benign prostatic hyperplasia. All right? And that is why I'm so passionate about this topic, because prostate cancer is the leading cancer, or the leading cause in cancer in men. All right? A lot of men are dying because they're just sitting home and they don't take the initiative to go to their doctors. They don't look out for the signs. They're not aware of what to look out for. And this is the entire aim of this program today, to bring awareness and sensitize the public, especially the men, of the signs, the symptoms, and so on that they have to look out for early detection, because early detection could save lives.
Definitely.
All right.
Definitely.
So that is, in essence, why I'm so passionate about it, because I love medicine, I love people, I love interacting with my patients, I love answering questions, I love the whole interaction, and that is the whole reason why we're here today, to promote and prevent deaths and complications.
Okay, wonderful, wonderful. Well said, Dr. Baptiste. Okay, so we just want to touch on, many persons are going to ask, okay, the prostate. Some men, I guess, even with patients or so that you even had encounters with, sometimes they may have had certain complications or signs and symptoms, but they weren't even aware that it had anything to do with their prostate. Can you just educate the public a little bit more as to what the prostate is? When we talk about the prostate, does female have a prostate?
Unless you're maybe a transgender female, unless that is the case, then female wouldn't have a prostate. Female generally, females don't have a prostate.
Good to know.
The prostate is basically a gland that is exclusively a male, the male anatomy, right?
Yes.
It is exclusively a male gland. Yeah, so we don't have females having a prostate.
Right.
So the prostate is basically a very small gland, the size of basically a walnut,
Yes.
or like a golf ball,
Yes.
and it is situated just beneath the bladder. All right, the urinary bladder. You know, we have the gallbladder, we have the urinary bladder. All right. So based on the anatomy, just below the urinary bladder, the prostate is situated, and the normal size, as I said, is a small gland. The normal size is about the size of a walnut, or the shape of a golf ball, the size of a golf ball. Right. So that is what is basically the prostate. The prostate is a gland that is responsible for helping with secretions and so on with the semen.
Okay.
And
so when you say semen, we're saying
yes,
where the sperm,
the sperm and so on. You know that the male genitalia. We have the testicles. We have the prostate gland. We have the seminal vesicle. And all of those things basically produce that organ, that hormone called testosterone, right? Which basically what defines a man, defines masculinity, basically.
Okay, correct. Yes. Yeah. All right. Okay. So guys, so we understand that the prostate is only found in men, and then we understand how
It's only found
pretty
in men.
nice and small. So it's like, you know, like if I do this with my hands, it's pretty there.
No,
right.
This
So
one you
it's
have
like-
is very big. This one you have like an orange.
No,
So
it's pretty
it's
small,
like
as you
this,
said, like a golf ball. Pretty small. Okay,
Yeah,
good.
a walnut, a golf ball.
Okay, all right. So we know. Okay, all right, good. So now, tell us a little bit more. So in terms of the anatomy, how does someone know that they have to check their prostate? What does a patient? What are some of the indications?
Okay, so let us speak a little bit more about the prostate, because if we know a little bit more about the prostate, we'll know about what are the things that we're supposed to look out for. So the prostate is a gland, as I told you, very small. Its function is to secrete. It basically produces things like sugars, like fructose, glucose as well.
Yes.
Things like citric acid. It produces an alkaline environment as well for the spermatozoids and so.
Yeah.
And also it has things like enzymes and so on, the protease and so on. All right. It basically has 3 different layers. So let's take, for example, a fruit.
Yeah.
All right. The outside of the fruit, you have the skin.
Yeah.
All right. We could see the skin as the peripheral aspect of the prostate.
Right.
Yes. And that is where they have certain cells and so on that secretes a lot of different things like enzymes and so on. In the middle of the fruit, the fruity part that you would eat, the body of the fruit, you have things like what we call the stroma and the glandular aspect of it.
Okay.
All right.
Yes.
And in the middle of it, we have the stroma, which is the transitional aspect of it, and then in the middle of it you have the center. So it's like the seed or whatever the stick is the center of the prostate. And based on those different regions, we have the different diseases that would normally affect men. All right. The cancer of the prostate is basically found, or is basically originated from the peripheral aspect, which is like the skin of the fruit.
Okay.
And the benign prostatic hyperplasia basically originates from the transitional zone, which is like the fruity
fruit
part
itself.
Yes.
Okay, guys, I hope we understand that.
So
makes
just
sense.
to give us an idea as to what we normally look for, and so as to the signs and symptoms that we normally look for as men, there are quite a number of them. Yeah, and we'll touch on 3 different topics, which is benign prostatic hyperplasia, adenocarcinoma, and also prostatitis.
Okay.
Yes, we'll touch on the 3 of them. Some of them could give you different signs and symptoms, but the general symptoms and so on that we look for are things like difficulty to pass urine.
Okay.
You find it difficult to pass urine, you have to force to pass, and it burns whenever you're passing the urine. So that's one of the main symptoms that you would look for.
So this is in general, or in
general.
in general,
In
as
general.
pertaining to any type of disease of the prostate.
Disease of the prostate.
Okay.
We also have things like what we call frequency on urination. So you have to go to the bathroom every half an hour, or every hour you have to go empty your bladder, because you just cannot withhold the urine.
Okay.
So that is a next sign or a next symptom that we normally look out for. Also, things like urgency. You realize like you can't wait to reach the bathroom, and before you reach the bathroom, you pee yourself.
Wow.
And a lot of men are experiencing those symptoms. They experience it and they don't go to the physician, they don't go to the doctors.
Okay.
Right? So that is the next very important symptom that we normally look for. Is a general symptom. Also, difficulty voiding. You feel like you pass urine, but half of the urine stay back in your bladder.
You still feel full.
You still feel
want
full.
to, use the
Exactly. So
bathroom
that's the
again.
next symptom that we normally look for. Also, what we call a wick stream. You're passing urine, but it falling right in your foot and it wetting up all your toes.
Okay.
So that is a very important sign.
Yeah.
Yeah, of obstruction of bladder obstruction. And next sign that we normally look for, and we will ask our patients if they're experiencing, is if they have what we call terminal dribbling. So you pass urine, you put back your organ in your pants, basically, but you realize that your boxers still a bit wet.
Okay.
Because it's dripping, even after you would have passed urine. So those are some of the signs, the symptoms that we normally look for, and we normally ask patients or men if they're experiencing, to see whether or not if they might have some sort of issue with the prostate.
Okay. So now, in the event that we have let's say we have a clinical case, we have a 54-year-old, so he's coming in for a general check at his physician, right? Family doctor. He pretty much is not saying any of his complaints, but he may have little complaints. Maybe, for instance, he's not, when he pass urine, as you said, instead of being able to shoot straight on a wall, it's actually shooting more down, and it wets his pants.
At 54 years, I don't think you're looking for shooting shit on a wall.
Well, some of them think they can. You never know. You never know.
I think at that age we don't aim it for the wall. We might aim for close to the wall, but not for the wall.
Dr. Baptiste, some men are very, and they are very confident, and when you ask them, are they shooting at the wall? Trust me, they will say they are shooting at the wall. Okay.
I would love to meet those 54-year-olds.
Okay, so let's look at this case. What
Okay,
if he, all right, so he's not gonna he's not telling us that's basically his only complaint, pretty much, is that yes, I may not be shooting at the wall, but that maybe when I pass urine or so, or it's actually I spill a little bit, right? So the boxers get a little spill at times, right? What would be the first investigation or the first test you will do as a physician?
Well, the first test, and I'm a physician. I base my practice in clinicals, right? Always based on clinicals. So first of all, that person we do a very good interrogation.
Yes.
We ask them all the signs, the symptoms, and so on that they're experiencing, and then we will proceed to do a general checkup, but more so we'll specify in what we call a digital rectal examination,
Okay.
which is very important.
Yes.
And a lot of men, because as I said, because of our culture,
Yes.
we have a Grenadian culture or a Caribbean culture, a macho man culture, where
Preach
we
it.
do not want physicians to put a finger in our buttocks.
So before you even go there,
Uh-huh.
so can you explain the procedure then for us? Because as you said, putting a finger in the and you say buttocks, you know?
Yes,
In
in
the area.
in the rectal area.
Right, in the rectal area. Can you explain the procedure and in such a way that it's not horrific? Because many men think it's such a horrific experience, and
I think it's
also
based
they
on
may
culture
have,
as well. Based on culture.
yeah, and they actually would have even made other men afraid as well, as in terms of doing the DRE.
Okay.
So can you just run us through a little as to the procedure?
So-
what is really this digital rectal examination?
Okay, so let me go back to the anatomy because everything is based on anatomy.
Correct.
We ain't
yeah.
doing madman science.
No.
We're doing science is based on certain rules and certain things that we follow.
Yeah.
Based on the anatomy, the posterior aspect of we said it was the bladder. The prostate lies just below the bladder.
Right.
All right.
And we said it's like a nice little walnut.
Exactly. All right.
And then we have our
and then we
urethra
have urethra that takes
between.
the urine basically from the bladder to the outside.
That's correct.
Okay.
Right.
So the prostate is lying in that zone where, based on physical examination, based on assessment, we could basically reach it.
Assess it.
And it's
yes.
not only that. Remember we said that the peripheral aspect of the prostate is where the adenocarcinoma, or what we call the cancer of the prostate, normally originates.
Okay.
So it makes it more accessible for us to determine whether or not that person might have, based on how it feels, if it is smooth. Those are some of the things that we look for. If there aren't any nodules,
Or we'll say
and so on.
bumps.
If it is kind of soggy, or whatever the case may be,
Yeah.
based on our ability to access that organ, that gland, we would have a clinical idea as to what that person might be experiencing. A lot of people, for example, and we get it wrong, a lot of doctors, they exempt or they omit obviate the clinical examination or the physical examination, and they just send somebody to do a test, which is not correct, which is not the right thing to do. Because a lot of the times, the test that they send to do could be altered based on different processes, all right? And it could give us a false reading.
Okay.
But whenever we do that physical examination, we get an idea as to what we're dealing with. If it might be BPH, which is benign prostatic hyperplasia, or if it might just be a cancer, or we might be dealing with a prostatitis. Because all of those things could elevate what we call the PSA, which is the test that the doctors would normally send them to do.
Okay.
All of those things could elevate the PSA.
Okay, so we're still waiting from persons for you to explain the digital rectal exam.
Okay, so the digital rectal examination is basically, as I said, the physical examination to examine the prostate.
Okay.
With the patient lying, we normally put them in two positions. The patient could either lie on his left side with his knees crouched, like in a fetal position.
Okay, yes. Fetal position.
In a fetal position.
Yes.
And we basically, with the index finger, we feel for that prostate gland.
Yes.
Yeah?
Yes.
We feel and we assess, as I said, the contours of it,
Yes.
how it feels, the consistency, all of those things of the prostate.
And then from there we're able to deduce what
Yes,
then.
we'll be able to deduce more or less what's the size of the prostate. If we're dealing with maybe a prostatitis, or we're dealing with a possible cancer of the prostate, or if the prostate is very enlarged, which might be a possible BPH.
Okay.
All right. The next way we could normally normally use to test the prostate is with the patient bending over, but we rarely use that method. most of we use the patient lying in on this left side in a crouch position, in a fetal position.
Okay, all right. And would you say that this is, I mean, at the end of the day, we are the physicians, you know, but would you say this is actually the clinical practice in actually assessing the prostate, right?
That is the
So
clinical
it is
or the
something
physical
that
examination.
it is something that is necessary for men, even from the time, let's say, age 40, to start considering and doing a digital rectal exam when they get to the physician in assessing their prostate.
Definitely.
Right? So whether they may have rumors about it, oh, they don't want a man putting his finger there, or they don't want, that is the actual clinical way
That
in
is the clinical way
assessing
of
the
assessing.
actual
Exactly.
prostate. Okay?
And I don't think any physician, any good practicing physician should omit
this.
that physical examination.
Okay,
Yeah?
wonderful. So men, you all, I hope you are well listening, that it is very important for your physician to assess the prostate, whether you may think it might be unseemly or it may be something that you think, you know, you may not want, but at the end of the day, that is the actual exam that would assess your prostate and actually give you a real picture as to what is taking place. Okay.
I just wanted to make a point, especially when you spoke about men over 40. Yeah. And I don't want us to forget that at all. We don't want to leave that out.
Yeah.
The risk factors,
Yes.
because I am very big on risk factors.
Yes.
The risk factors are things that would basically put you at risk. It increases your chances of you suffering some sort of prostatic disease. All right. So, as Dr. Louison would have mentioned, over 40, men over 40, that is one of the risk factors.
Yes.
But we have a lot of other risk factors that we have to consider as well. One of those other risk factors would be not just the age, over 40, but we have to think about the cultural and the socioeconomic background of that person.
Okay.
What we find is that people that have a better, I shouldn't say better, yeah, but people that has a level of, maybe that they would have attained a certain level of education, maybe at the university level or whatever the case may be, those are the men that would tend to seek their health a bit more, or be a bit more concerned about the prostate and the health of the prostate. So we see that the people that are more negligent in going to the doctors and so on and checking out the prostate are people that generally, and I don't want to be very specific, but people that are generally, they don't have that level. That level of
so you would say
scholarity,
education or access to education.
Exactly. So that is one other risk factor that is very important in our society. Yeah. Other risk factors are things like your genetic history, your hereditary history. Your father would have suffered with some prostatic problem. Your father used to pass blood through his penis and so. Yeah. He used to pee blood. Sometimes he never went to and checked the doctor about it. But you know that daddy used to suffer with that. So it's upon you now to go to your doctor and get it checked, especially knowing that daddy would have suffered with those things. Yes. All right.
So before, sorry for cutting. So at what age would you think? Okay, so if there's a young man, he's in his he's say 28, right? I'm not even going to include in a case where he ever had anything, I'd say a prostatitis or anything. Just 28, but he knows that his dad at age 50, right, had BPH, benign prostatic hyperplasia, right? Would you think at that age, just he has no risk factors per se than just his dad having a history of BPH at age 50? Would it be advised for him at that age to do a DRE at 28?
At 28, I still wouldn't say we'll advise it at 28, because generally anything from 40 onwards, the risk factor increases. But we would, in that situation, everything would be based on like the clinicals as well.
And what is he's presented
and what
with.
what is if he's having difficulty passing urine from that age, then we'll proceed to do a workup, do a physical examination, maybe check the prostatic specific antigen and all those things.
Okay.
Yeah?
So for
So
instance,
everything is based on the background, based on the clinical
the
background.
history, correct. For instance, another history, same 28-year-old has a history of prostatitis, right? And the prostatitis could be as a result of, which I know we're going to get into.
We'll get into that.
Right? But just say prostatitis, right? So he has a, say, previous history, maybe twice. He had inflammation of the prostate. All right? And would he be a better candidate in terms of doing the DRE? He may have come in this time now with super pain, lower abdominal pain. Would he be a candidate for the DRE and the PSA test? And
Well, definitely. Based on the background of what the person is presenting with, if somebody comes to me and they 28 years or 25 years or 18 years with burning sensation, difficult to pass urine with, let's say, secretions through the penis, the penile area. They have lower abdominal pain and so on. Then all of those symptoms and so on would point you to the direction of a possible infection or inflammation of the prostate gland. All right. In that case, the sexual history is very important as well. Yeah, you want to know that person, what relations they would have had, and all those things. And in that background, we'll proceed then to do a proper physical assessment, which would include a DRE.
Okay,
The
wonderful.
digital rectal examination.
Okay, so from some of our viewers, we would just like to use what exactly is prostatitis?
What exactly is prostatitis?
Yes.
Hold on, just a minute. We'll get to what is prostatitis in just a bit. I wanted to finish speaking about the risk factors.
Okay then.
Yeah.
Okay.
I
Alright.
want to jump the gun. I want us to get yeah.
Okay, no problem.
So, as I said, risk factors are one. We spoke about the hereditary aspect of it, the genetic aspect. We spoke of the age. Also, we have to think of race as well. Once we're speaking of age and we're speaking of genes, we have to speak of race. And it is something that is very predominant in the Afro-Caribbean, Afro-American community. All right? We see a lot of people by the age of 50% of Afro-American men or Afro-Caribbean men suffer with benign prostatic hyperplasia.
Okay.
80% of men that are 80 years old, 80 years or even older, 80% of those men suffer with BPH as well. So those are things that we have to consider, the risk factors, because those the risk factors would enable us to make a early intervention, to promote and prevent.
Early screening.
Also things like a sedentary lifestyle. People that tend to be less active, that they work a job that is seated for long periods of time. They don't, when they reach home, they eat all sort of stuff. When they reach home, they don't do anything either. Those people are at risk as well for suffering with both prostate cancer and also BPH. Things like the foods that you eat, the saturated fats and so on, all those things contribute. And there are also foods that will help you that will aid you in preventing prostatic diseases. Things like foods rich in zinc and so on, based on certain studies that have shown those things. So all of those risk factors, we have to keep them in mind.
All right.
The
So
sedentarism, sitting a lot, the age, the genetic history, and all those things. Even I was reading, and it's evidence based. It's said in the literature that people that have multiple sexual partners generally tend to suffer with prostate diseases like BPH and adenocarcinoma as well.
Why so though? What has the literature said?
The literature is basically saying with multiple sexual partners, you have a greater predisposition to have things like prostatitis and so on.
Exactly.
So once the rate of infection increases, meaning that a person that has multiple sexual partners, they stand a greater risk of getting more infections, more things like gonorrhea, chlamydia, trichomatis, and all those things.
That's correct.
So it kind of predispose them to suffer more with prostatitis and eventually suffer with like things like BPH.
Okay, so I think we definitely had a well list of the risk factors. All right, and again,
And there are other risk factors as well, but those are the principal risk factors that we yeah.
Okay, and the lifestyle, as you mentioned, in terms of the foods. So can you tell us a little bit more in terms of the foods or the fatty foods, and how does it contribute somewhat? Like, how would I, for instance, okay, so we have a gentleman, if he's having, he loves to have his barbecue chicken on weekends, his 2 beers, maybe every other day, you know, he loves his fried chicken and fries, like, how does that contribute to BPH, which are benign prostatic hyperplasia, or anything pertaining to his prostate?
So, based on science and research, the physiology of it, meaning that the natural process, that's how the hormones are made.
Yes.
Testosterone is the male hormone that is made by the testicles.
Yeah.
Yeah. Testosterone is basically made from cholesterol and cholesterol is converted into things like estrogen, and then it is converted to testosterone.
That's right.
Right?
Yeah. So we have to have
If you
fats
consume
first.
if you consume a greater amount of fatty foods, fat-based foods, it means that it would ultimately lead to the cholesterols and so on, the triglycerides and all those fatty foods and so on. They would lead to an increment or an increase in those
hormones.
Those hormones, yes, basically, and that in turn would lead to more production of testosterone. There's a particular enzyme in our body that we have at the level of that we have at the level of the stroma and so on. It is called alpha reductase, and what it does, it takes testosterone, which is the hormone, and it converts it to what we call dihydrotestosterone. And dihydrotestosterone, it then binds to, that's more scientific stuff.
Yeah.
It binds to the androgens receptors, the androgen receptors, leading to hyperplasia.
Which will be, it will bind to the prostate, these areas in the prostate.
It binds to the receptors, and in turn, those receptors trigger off what we call hyperplasia, which is like multiplying.
More growth.
Yes. A lot of the cells and so on keep multiplying, and then it leads to a big prostate, which creates all sort of problems later on in life for you.
Yes. So, okay, so as guys, we just heard from Dr. Baptiste as to why these fatty foods and so on, how they contribute to actually causing benign prostatic hyperplasia. So the more cholesterol in the body, more testosterone, more actual DHT, and then the DHT will definitely stimulate those
the growth of the cells,
the growth
and
of the
the
cells.
multiplication, because hyperplasia in simple terms, to put in simple terms, is multiplication of cells.
That's correct.
When you ever hear about hypertrophy, the cells gets bigger, but hyperplasia, you have a multiplication of the cells.
Excellent. Increased number of the cells, right? And as a result, then that's where, and we just talked about the urethra being actually between, it actually passes through the prostate, right? So if in the event that this now has become enlarged and it's growing, it actually obstructs the urethra.
And that's why we have a lot of the complications as well. So we have things like people that suffer with prostate eventually start suffering with their kidneys, because the kidneys now have a buildup of urine.
So there's retrograde.
Exactly. A buildup of urine, and it doesn't, it's unable to pass.
Exactly.
And then you get all the symptoms, the forcing to pass urine, because you have to force a bit more. You have things like diverticulum of the bladder.
Okay.
Whereas the bladder, you have to force so much that it actually start to make things like pockets.
Weakening of the bladder wall itself.
And then the bladder wall itself becomes so thick. Okay. Because you have to work so hard to overcome that force.
Wow. Okay, so I hope a lot of our men out there are listening, are understanding, exactly what are some of the complications of benign prostatic hyperplasia. We're getting a lot of information this evening, in a very simple but explicit way as well, that we can actually visualize, what is really taking place on the inside. Okay, so that,
let's proceed to talk about
the prostatitis.
prostatitis.
I'm very excited about the prostatitis. prostatitis, I must say, because I think it's something that we have seen most likely when we talk about benign prostatic hyperplasia. You most see it in older men.
Older men, yes.
But
prostatitis, you find it in every age group.
Exactly,
Yeah?
and you see it a lot in young men
in younger
now.
men as well.
Right, so it's something that we really want the young men to be aware of. So tell us, what exactly is prostatitis?
So whenever you hear titis, because sometimes you always hear doctors use terminologies and so on, and you hear itis and those things. Anything that ends with itis, it basically means inflammation. Inflammation of a particular organ, inflammation of a particular region. So prostatitis, in simple terms, is inflammation of the prostate. All right? That inflammation could be acute, meaning that it started just recently, or it could be something chronic, meaning that for a long period of time, you're experiencing that and it will never go away. All right? So those are the two classifications that we have. All right? In the acute prostatitis, we normally see it in younger men. Why? Because younger men tend to be more sexually active. They tend to have more sexual partners.
Yeah.
And whenever we have a bacterial infection of the prostate, yes?
Okay.
So prostatitis, basically, acute prostatitis is basically a bacterial infection of the prostate gland.
Okay.
All right? That leads to all of those symptoms.
Okay.
And it could lead to, as I told you, we explained the symptoms before, burning sensation and urination.
Okay.
All right? You're trying to pass urine and it's burning you. You have that burning sensation. You have that lower abdominal pain.
Yes.
You have that frequency. You have to go and pee every little minute. And you have that urgency as well, meaning that you have to go and you even pass sometimes urine on yourself. If you don't reach to the bathroom, you could pass urine on yourself. All right? And those are the things, the bacteria and so on that are very common are things like chlamydia, things like gonorrhea, things like trichomatis and so on. Those are the bacteria that are more common, commonly found in acute prostatitis.
So in acute prostatitis, does a patient present also with a discharge? Because
it's possible. It's very possible to have a discharge. Exactly. And I have from just experience, I've treated a lot of young men that have recurrent infections, especially with gonorrhea and so. They come to you, they come once, they come twice, and so on. And those things, recurrent infections develops. It basically leads to a chronic
inflammation.
Yes, a chronic evolution.
Okay. So
a chronic
state,
evolution. So it becomes chronic after a while.
Okay.
So you would have had it once, you got treatment for it, you came back a second time, you got treatment the third time, and then it just persists from then.
Okay.
Yes. The symptoms, they have that constant burning. They have that constant difficulty to pass urine. Constantly they have that abdominal pain, that low abdominal pain and so on, that discharge.
What would we see on clinical examination for a patient with prostatitis in terms of the clinical presentation
generally,
of the prostate?
The clinicals, what we would sometimes see, especially if we do a digital rectal examination, you have this discharge, that whitish discharge that that comes out whenever we massage the prostate.
Okay.
So sometimes we massage that prostate and there's this white discharge
that would just
that comes
right
out. That discharge, we could even take a sample of it and sometimes send it to the lab to test.
Correct.
Yeah, for culture, for sensitivity, to see the white blood count and so on. And that gives us an idea as to what we're dealing with exactly.
And the exact organism that is
whatever is causing that
inflammation
of the prostate gland.
Okay,
and that is acute prostatitis.
Yes.
In chronic prostatitis, as I said, the evolution is a patient is that experience that for a long period of time and it doesn't go away. All right. Chronic prostatitis could also be classified into abacterial, where a bacteria, you do the massage of the prostate, you send the sample to the lab, but no bacteria, no organism could be found or isolated.
Yes.
And then you have the bacterial, where you find a particular bacteria, but it just persists. It goes on for a long period of time.
Okay. And in general, prostatitis is usually treated in The
prostatitis is generally treated with There are different ways we could talk about medical treatment, which we normally use for acute prostatitis. So we normally recommend like antibiotics and so on.
Yes. Okay.
Or we could even do like surgical procedures if that person has that persistent problem and so on, and they're just not getting any better. Then we opt for surgical treatment, sometimes to remove that prostate, whatever is causing that inflammation.
Okay, wow, interesting. Okay. All right, guys. So we heard a lot about prostatitis. So I think we can move on a little to benign prostatic hyperplasia. I mean, we kind of touched on it as well.
Yes.
But still, in case our viewers would have missed it a little bit, still, if we could add a little bit more. We talked about in terms of the presentation, risk factors, or so. But is there anything else in terms of what are our patients going to be looking for? For instance, you go to your general physician. You take a blood test, and we talked about the prostate specific antigen test. And how would someone know that their levels are elevated or it's within normal limits? What are the values we're looking at here?
Okay, so this prostatic specific antigen, as we discussed before, is something that is an antigen, is a protease that is made by the prostate gland. All right. And what happens is that it has a small amount that is found in blood. So you take a blood draw, you send it to the lab, you test it for the prostatic specific antigen, and it would give you values of 0 to 4 nanograms per milliliter. Yes, that is a normal range.
Okay.
Anything above that is a bit elevated.
Okay.
As I said before, those things could elevate in any of those processes.
Right. Okay.
Yes, it could elevate with a prostatitis. You could have someone with acute prostatitis and they have a PSA level of 60 something or so. Okay. So we have other specific tests within the PSA that gives us a better idea as to what process it might be. Because as I said before, the different layers of the prostate produce different things. We have what we call the bounded PSA. The bounded PSA gives you a better idea as to a cancerous process. If the bounded PSA is elevated, then you start thinking cancer.
Okay.
If the free PSA, that is when it travels in the state without being bounded to anything. If the free PSA is elevated, then we think BPH or benign prostatic hyperplasia. Okay. Yeah. So that is one way which we kind of differentiate as medical professionals. Okay. What might be something benign or what might be something cancerous.
Okay. And we talked about the location and so what would actually make it. Okay. And for instance, in terms of the clinical presentation and the feel of it. All right. In terms of if
we spoke of the feel of it,
yes, and everything like that. Okay, so we have a question. I'm just going to throw this one from one of our viewers on YouTube, Mr. Timon Thomas. Okay, so his question basically says, aside from refraining from having multiple partners, is there anything the female partner can do that lessens the likelihood of such an infection?
The female partner what the female partner could do?
I can answer that because
please do.
So Mr. Thomas, so at the end of the day, we're talking about infections here, right? So hygiene would definitely be a very important thing for both partners, right? So as Dr. Baptiste said, whether it would be like an STD in terms of gonorrhea, chlamydia, so hygiene is definitely going to be important. Definitely. So when having this type, whether one, he talks about having multiple sexual partners, so it's on both sides, Exactly. Yes, we're talking about a male disease, a male condition, but we're also talking looking at both partners should take that responsibility. Definitely. In being in protecting each other, so whether you're using protection or so, and hygiene is of course very important as well in preventing the likelihood of prostatitis. So I hope we helped answer your question in terms of a female.
There are several things that we could do.
But he said for a female,
One is limit the number of sexual partners, of course.
Well,
maybe to 1 or 0, which is abstinence. Also, if you
That
have
is
multiple
true.
if you have multiple sexual partners, then you use protection.
That's correct.
You use protection maybe with the side women, and maybe with the main
What was
lady. Well,
I missed
we
this
have
one.
we have to be realistic.
True.
Yeah, the thing is, everybody, well, nowadays,
Everybody with the men inside here today.
You hear a lot about the side chick and the side women, so maybe if we could use more caution with the outside women.
So we
and
want to
and
lesson on the side chick, Dr. Baptiste.
we can lesson
I
on the
agree.
side. We
let's
definitely,
lesson on the side
we
chick.
definitely want to lesson that. But if we
Yeah.
are looking at other alternatives and other ways of preventing it or preventing it to prostatitis, then we have to be realistic about it.
Exactly.
Yeah.
Exactly.
And we have to be realistic about the society that we live in.
Exactly.
We have husbands, they have their wives, but they have women outside.
Yeah, the side chick.
And that's the nature of it.
Yeah.
That's the nature of it. We
Yeah.
have to be honest.
And then you bring that home.
Exactly.
Right.
So then, at least if you know you're living, maybe you want to run that risk.
A frivolous
and
life.
You're
You're enjoying.
You use protection. You use
Yeah.
contraceptive
Yeah.
methods or the condom.
Because eventually it could haunt you. It can come back one way or the other.
Definitely.
Yeah. So I hope we answered Mr. Thomas'
And
question.
some people bring it home for the wife. Yeah, it spreads.
Yes, it
That's
spreads.
the nature of infectious disease. They spread.
And in her case, then she would then be lead to pelvic inflammatory disease.
Exactly.
Or, so
And the
it's
cycle
same,
continues.
The cycle continues.
It's a vicious cycle.
Yeah. All right. So I think we looked at benign prostatic hyperplasia, and then we also can. What I really appreciate is that you were also explaining that based on the value, because I know many patients are afraid of the value, but as you said, there's different parameters to determine whether it is prostatitis, whether it's benign prostatic hyperplasia or carcinoma.
There are certain specific within that PSA itself. There are certain specific values that you could look for that would give you an indication as to if it might be cancerous or if it might be benign.
So in the case now of cancer, what are the things we're looking at?
So in the case of cancer, cancer generally, and that's the funny thing about it, yeah, cancer generally don't give you much symptoms until it's kind of advanced. Yeah, and that is something. That's why we have to screen early.
And that's why the
as
DRE
men.
is so important.
And that is why, especially men that has a strong family history of
Yeah.
prostate cancer, they have to start screening even earlier.
Yeah.
Because generally we don't get symptoms until that disease is a bit more advanced. So you get some of the same symptoms, especially with advanced cancer, but you could also get a lot of things like back pain, lower back pain, especially when you have metastatic disease,
when
when
it
it would
has
have traveled already.
Okay.
You could have things like lower back. You could have the same burning sensation, difficulty to pass urine. You could have the same difficulty to empty the bladder completely. You could have you could also have things like the weak stream and all of those things. But also you could also have things like in metastatic disease when you would have traveled already, lower back pain,
Yes.
hip pain,
Yeah.
and so on. You could even have, especially if you would have gone to the lungs, you could have traveled to the lungs or to the liver,
Yes.
because they have a tendency to travel, especially to the spinal region.
Yes.
Yeah,
Prostate to the bone.
prostate
Yeah.
generally they travel to the spinal region, but it could also travel to the lungs. It could also travel to the liver, and then we would get symptoms like we have even cases where prostate cancer it travels to the brain, and you start getting things like seizure activities and all those things.
Yes.
Yeah,
Yes.
loss of consciousness and all of those things. Yeah, even symptoms like shortness of breath.
Yes.
You know, whenever you would have traveled, you get jaundice and all those things,
Yes.
that yellowing of the eyes and all of those things when it is already advanced. So it's very important to screen, especially for prostate cancer.
Okay. Wonderful.
And things like, as I told you, the risk factors like having a known family history of prostate cancer in your family, you start trying to screen very early.
So what age would you advise the public in terms of screening?
Well, 40 years, that is generally recommended, but we
That's
see
correct.
persons now suffering from prostate cancer even at earlier ages, like 35 and so. So maybe from early as 30 if you have a risk factor.
Okay, so what
You
are
could
some of
start
the
screening.
incidents we saw with with actual prostate cancer here in Grenada
Well,
specifically.
with the prostate cancer, and I was referring to some of the statistics.
Yes.
And it's very prevalent. I work on the male surgical ward at the General Hospital.
Yes.
So I could tell you, almost every admission or every 1 in every 10 admission that comes in is someone that comes in for a prostatic process.
Okay.
Yeah. Whether it be BPH, whether it be prostatic adenocarcinoma. In 2015, we had 46 male being basically diagnosed with prostate cancer, and we had 6 deaths. All right. In 2016, we had 8 deaths, and 48 persons were diagnosed. In 2017, we had 11 deaths.
Okay.
And if we continue, as we look at the trend, it keeps trending up.
Yes.
Yeah.
Yes.
And that is because of the detection and so on as well. A lot of people would have suffered with prostatic conditions and they never attended to the doctors. They stayed home and maybe they would have died. So those people, they don't even count in the statistics.
In the statistics, that's correct. Yeah. Yes. Okay. All right. So we have a question here for you, Dr. Baptiste. So the question is there, from Mr. Shane McQuilkin, the question is there any relation at all between erectile dysfunction and prostate disease or infections? Good question.
If there is any relation.
Yeah, between erectile dysfunction and prostate disease or infections.
Okay, so to speak of erectile dysfunction, we have to cover different systems, different systems.
Yeah.
Yes, there could be there is in some cases a relation.
Yes.
Yeah.
Yeah.
Because in erectile dysfunction we have what we call the endocrine metabolic system. We have the psychological aspect of it
of the man
as well,
of the male.
and then we have what we call the organ.
Yes.
Which is genitalia.
Yes.
All right. In cases where there's a compromise in blood flow and so. Based on obstruction of certain different arteries and so on, or the venous system and so on.
Yes.
It could lead to erectile dysfunction.
Yes.
Yeah. So those diseases, it could have a relation between prostate malignancy or prostate benign prostatic hyperplasia and erectile dysfunction.
Based on the dysfunction with the system.
Based on the dysfunction with the organ itself.
Okay.
Yeah.
Okay.
If the blood flow and so on, those things are compromised, then you could have erectile dysfunction.
Okay. All right. And again, just to mention, so we talked about, I just want to bring up again with the lifestyle.
And then the psychological aspect of it. For example, somebody that knows they have prostate, sorry to cut you.
No, you go right
Somebody
ahead.
that knows definitely that they have like prostate CA.
Yes.
Or prostate cancer.
Yes.
That person already in their mind is
trauma.
negative.
Yeah.
Is negative, so the psychological aspect of it, there's this thing that we call the libido.
Yes.
That is very important, just as the functioning of the organ itself, as well as the vascular part or the irrigation or so. The libido is very important, especially when it comes to sexual intercourse or sexual pleasure, whatever the case may be. And if that aspect of a person is affected, then with knowing that the diagnosis, then it definitely would affect them as well.
Okay. All right. So I'm just going to take another question. We have a question from Lish. She says, or I'm not sure. Okay. The question is, can prostatitis lead to infertility in men?
Yes, it can. So inflammation. Prostatitis is basically inflammation of the prostate gland. But remember, the prostate gland serves a very important role, especially in the substances and so on, the secretions that it adds to the semen. So you have the alkaline condition that it uses to facilitate when the sperm gets into the vaginal canal. Because the vaginal canal, is acidic conditions. So all of those things, once it's compromised, then it could lead to low sperm count. It could lead to infertility. Yeah. So there's definitely a relationship.
Okay. All right. So also, what I really wanted to get to as we were going back to lifestyle in terms of like alcohol consumption. All right. So many persons may not understand in terms of, because we talk about fats, we talk about the the fatty foods and the sedentary lifestyle. But what about the alcohol? How does alcohol contribute in terms of with the in terms of lifestyle and prostatic BPH? What does increase in glucose as well do?
Well, it's a same based on the same physiology and so on. Right, alcohol affects you on so many different levels.
Yes,
especially addiction.
Yes,
and not just from the metabolic standpoint, where you have glucose being broken down into converting into fats and so on, and then and the storage and all those things.
That's right.
It's not only those things, but it's talking about the mental aspect as well.
Yeah.
We just spoke about the psychological aspect.
In the erectile dysfunction as
exactly.
well.
So alcohol would affect you on every different level. Whether it be metabolic, psychological, it affects you. Even not just alcohol consumption alone, but things like coffee. A lot of coffee and so also affects like it could
so
lead to
the caffeine.
It can lead to BPH as well.
Okay.
Yeah.
So would you say like power drinks then? Those power drinks
all of those,
that have a lot of caffeine
all
in
of
them.
those things.
Okay.
Yeah, they lead to BPH. They lead to BPH more so than prostatic adenocarcinoma.
Okay, all right. So, Dr. Baptiste, I mean, we talked a lot about prostatitis, we talked a lot about BPH, we talked a lot about, we even touched on the adenocarcinoma of the prostate, which is cancer. All right. So we're still also welcoming many questions from our viewers and listeners. Please feel free to continue to send your questions to myself and Dr. Baptiste. He's right here and willing to answer your questions. So in the meantime, we're still going to just touch a little bit on the adenocarcinoma, which is cancer of the prostate. So for instance, we notice sometimes there's patients who let's talk a little bit about presentation. And I know you mentioned most of the times the findings be late. All right. There are persons who would be home listening on and they know that they may have certain things but there's a worry. And there's also a lot of taboos as well out there. There's taboos that if I have a prostate situation and I cut it, they said that is it. Death. There's a local taboo about those things, right? Can you just educate the public a little bit more about when does it reach to a surgical procedure where there must be resection? When is it okay to just treat, and when does it get to surgical repair?
Okay, so to answer your question, that is why you would go to your doctor in the first place, because we as doctors, we diagnose conditions.
Yes.
All right. And if you're having, for example, you have any symptoms and so on, you go to your doctor, then we set into motion the whole procedure as to how you should go about dealing with it.
Yes.
All right. A lot of people, they think that they might have prostate cancer, so they're kind of scared to go to the doctor.
Yes.
It might just be that it turns out to be something benign. All right. So the procedure, how we normally go about working up a patient. The patient comes with whatever symptoms or so. All right. We examine them, as I told you. We do a thorough history of that patient, the symptoms and signs. We go ahead to do a physical examination, and which could contribute a lot. Generally, we do the prostatic antigen, which is the next test that we normally do. There are other things that we use, things like the ultrasound. Ultrasound is very, very, very important, especially nowadays, especially with prostatic diseases and so on. The ultrasound gives us a better idea as to the size of that prostate.
Yes.
It gives us an idea as to if it's nodular or if it might just be adenocarcinoma or so. We have things also like not just the ultrasound, but we also have things like CT scans. We have things as the MRI, all of those things that we could use at our disposal now.
Yes.
If that is not sufficient, then we proceed to do a biopsy, all right, which gives us a definitive diagnosis. So a biopsy is what is a gold standard.
Yeah.
It tells us whether or not that might be something benign or not harmful per se, or if it might be something harmful as a cancer. And generally, prostate cancer is not a bad, not very aggressive as any other type of cancer.
Okay.
Yeah. So that person could still have quality of life. Based on the size of that prostate gland, we have a normal prostate is normally like 30 grams.
Yes.
All right? 30 grams. A person that has, and sometimes we have patients with a very small prostate, but it causes urinary symptoms. It causes obstruction. All right? So generally, somebody that has a prostate of less than 60 grams, there are different methods, as I said. You have the different way to resect. You have the TURP, which is transurethral resection of the prostate. You have TUIP, which is transurethral incision. Just an incision that is made to help someone pass urine easier. Generally, we go for medical treatment before to try to maybe facilitate the passage of urine, because we have drugs and so on that act specifically for the relaxation of the muscle, because we know it's a fibromuscular gland. So you have drugs like the tamsulosin and some that we normally use, right? And also we have things that we use to shrink the prostate, like the alpha reductase inhibitors. So things like the finasteride and all those things that we could use as medical treatment even before it reaches surgery.
Okay.
But anytime like a prostate reaches like 60 grams or so and it is causing discomfort, there's a score, index score that is normally used by the American Association for Prostate Diseases, where the urinary symptoms are graded on a score. And if somebody is a score of 1 to 5, if somebody experiences from like 4 to 5, they have a very poor quality of life. They have to get up 5 times in the night to pass urine and so, and it is very discomforting. We then determine whether or not what would be best for that patient, whether it be medical treatment, and if the medical treatment doesn't work, we opt for surgery. So there are a variety of different surgical procedures now to date that could be performed. We have things like the laser treatment, also the hydrotherapy, many different techniques that could be used. Yeah. Before we even reach to like open surgery or so. Yeah, so there based on the person's complaint or condition, there are many options. That person doesn't have to sit down home, because there are a wide variety of options that person could choose from to deal with their prostatic condition.
So in everything we're saying, in conclusion, it is not a death sentence.
It is not a death sentence, by no means. And even when it is cancerous, it's not a death sentence. Because there are treatment, chemotherapy, radiotherapy, all of those things. You could even do things like something that we perform here, which is removal of what we call an occipectomy, removal of the testicles and so on, by surgical procedure and so on. It's still not a death sentence. It has a very good, what we call a good prognosis.
Yes. Okay. So I think we got a really good, a well-educated overview on the prostate, the different diseases. Mainly, we talked about the prostatitis. We talked about benign prostatic hyperplasia and adenocarcinoma of the prostate. All right. So I think we actually got a wealth of information from Dr. Baptiste this evening. And as we did ask for a few questions, so we're going to take some more questions from our viewers. So another question, can a UTI lead to prostatitis and vice versa?
Definitely, because of the communication. We have what we call, especially in medicine, we have different ways of transmission. We have what we call the ascending method, where the infection basically uses a urethra, and it ascends to cause infection of the prostate gland, and posteriorly things like the bladder, where you get a cystitis. You could go even as far as getting a high infection, what we call a higher urinary tract infection, like a pyelonephritis, where the kidneys and the pelvic region of the kidney is inflamed or is infected. So it goes both ways.
Yes.
Yeah. The UTI could cause things like it could cause prostatitis, and a prostatitis could cause a UTI.
Yes.
Eventually.
Okay, because basically, the question goes, is it usually only STDs that lead to prostatitis?
No,
It's
no.
not it.
Any inflammatory process could cause prostatitis.
Yes. All right. So I hope we answered your question for you, Lish. So guys, again, it's a pleasure having you all listening and viewing on Heavenly Medicine. I hope we would have answered all of your questions, concerns, and you would have appreciate or would have actually received a lot of information pertaining to the prostate. So again, guys, I would like to thank you for listening. I hope that it was a blessing to you, and you would take this information and it would be of benefit to you and your family.
Share it.
We're asking you guys to don't be afraid to share with your family members, brothers, fathers. Again, it's all about awareness. We want the public to be aware of prostate disease, and don't be afraid that screening, once we address it early, therefore we can then treat early.
Early detection save lives.
Yeah. So as Dr. Baptiste just
the
said,
same thing goes for things like breast cancer, especially in women. Although it can present in men, and cervical cancer in women as well. Early screening, early detection. Do your pap smear, do your breast examination, your routine breast examination, your self-examination. All of those things are very important. Sorry to deflect from the topic, but those are the things that we want to promote. Promote to prevent loss of life and complications.
Excellent. Okay, so we have another question for you, Dr. Baptiste, from Mr. Trevor Thompson. The question is, this is just the information stage of the program. Needs 3 more sessions to get into question sessions. Okay, so definitely we can do more on, the prostate, because we really want the public to be aware and even make it more interactive.
Maybe we could have Mr. Trevor Thompson to do the next session. The following session will be you, Mr. Thompson.
Oh my goodness. Okay, so guys, it's a pleasure again, Dr. Baptiste, having you with us, and we want to just thank you for sharing with us on the prostate. It was very informative, and we know that many of our viewers will take this information and it will be a benefit to them, whether to their loved ones, family, husband, brother, it would be definitely a benefit, and it also would lessen those stigma and that fear from a lot of men from actually going to their family doctor.
We call it all men to man up. Yeah? You all need to man up.
Oh my
if
God.
If you think you're
he said it, not me.
If you think you're a true man, then you got to man up,
Yes, maturity comes with maturity, at the end of the day.
It's a manly decision.
Yeah, I agree.
And if you shy away from it, it's not
going to help you.
It's not very manly.
No, it's not very manly, because you need fathers. We need our fathers at home. We need husbands. You need them at home. So if they choose to make that decision and see their family doctor, it's a manly thing, ain't it?
And I'm speaking from a position where I've personal encounters every day. I'm talking about every day. I've encounters with people that they will come into hospital, they just bleeding out from the urethra.
Yes, we were going to talk about
bleeding.
that. Yeah.
I had this one patient, and sorry to share on this platform, but this one patient that came in with recently with a hemoglobin of 13, and that patient hemoglobin would have dropped to like about 6.
Okay, so his blood levels,
where he was almost in shock, and we had to transfuse him, and so. So don't wait till it gets to that stage. Yeah. Do your prevention, your promotion early.
Yes.
Go see your doctor, get your prostate checked.
Yes.
Yeah?
Very important.
Early detection.
Save lives. All right. Okay, so again, we just want to thank you guys for viewing with us, for tuning in. Thank you to all our viewers on YouTube, Facebook, and those that are listening on 103.1 Hope FM. We want to thank you. Have a blessed night. We're advising you to be safe. Take care of yourselves. So until next time, we're closing off. All right. Blessings to you all. Until next episode. Have a good night. Bye-bye.
She won't make it till the morning. inside. These feelings she's trying to hide, that's for another girl. It's not supposed to be. Only you know she prayed and prayed. How much she is afraid to get the help she needs. That your blood can set her free. Only you know he's going to church but losing hope. Cause he's tired of repenting for the same things over and over. It's almost over for him. Only you know I'm surrounded by broken people. And they need a hero. Cause they can't fix what's wrong on the inside. Your boy's here to see them. Doctor, can you heal her? I pray. Cause if you don't, she's not gonna make it. Doctor, can you heal him? I pray, yeah. Cause if you don't, come, no. Doctor, can you heal them? I pray, yeah. Cause if you don't, no. Doctor, can you heal them? I pray. Precision. Now, yeah. When the devil walks